Mrs. Sindoyi, Acting Nursing Officer at District Community Medical Office for Livingstone. Welcome to this interview. Thank you. Would like to find out about the situation of cervical cancer in Livingstone. Maybe you could just give us an overview.
The situation of the cervical cancer in Livingstone, according to the figures that we have from the time I started, I would say it's something that we need to really be aggressive about. Because so far, according to the figures, we find that every day we are getting about 3 to 5, every week we are getting about 3 to 5 suspects, which is an alarming situation.
Okay.
Yes. So to say it's something that we need to be aggressive about in order to save the lives of everybody.
Okay. So maybe you could just take us through some of the symptoms of cervical cancer.
Symptoms of cervical cancer, of course, you find that you have pain, okay, growing pain, and also foul smelling discharge. You find that a woman might complain of bleeding after coitus, and also pain. Those are some of the symptoms.
Okay. And from the research that we've conducted, we've noticed that most women do not really realize the symptoms until the cancer has gone to stage 3. Would you like to talk about that?
Yes, because the way cancer is, sometimes you might not know by the time you start having those symptoms, it will be too late. So that's why we are saying for us to know or to be sure, screening is the most important thing, so that you know, so that if there are, the cancer cells, cancer, what happens, you can be predisposed to, situations that might, cause a woman to have cancer. But the cancerous cells, for the cells to develop into cancer, they might take a long time, 10 years. So for a woman might not know until it is too late. Yes, that's why I find that most of the women, when they come to the health facility, it's too late. That's why we have this program, which we are very grateful about, whereby women are encouraged to go for cervical cancer screening, so that we are able to capture these women before it is too late.
When did this center open?
The center opened in July. It was opened by I think President of the USA, as you saw on television.
July 2013.
July 2013, together with the President.
Tell us about the interventions that Livingstone has put in place to fight cervical cancer, and how are you informing the women out there to come and test?
The interventions that we have put in place, like we are aggressive in making sure that the community is informed about the services that we have. Of course, as Livingstone, we have 2 facilities that are offering cancer screening, the hospital and this clinic, which is the Mosi-o-tunya Clinic. The interventions that we have put in place to make sure that our community is informed, we have put up a program. Very soon we'll be, conducting drama performances, and also we want to, go do a public address system to inform them about the services that we are offering here. But of course, we have our community partners that we are working with as health facilities. We are telling, of course, through the various health centers, we are telling them to, go door to door to inform people about the services that we have. As we do a lot of other programs, because we are integrating, we are not just looking at cervical cancer. So as we, send the communities to go and do sensitizations in the community, we are integrating. So as they do other programs, we are telling them also to mention about the services that we have, that we are able to offer as Livingstone District at this clinic.
Okay. And then if you find that a woman has cervical cancer, do you have facilities to treat such cases?
For the facilities, there are types, stages. There are, for those that we are suspecting, depending on the stage, we are doing part of the interventions here. The cryo stage, those that are found to be, suspected, depending on the stage, like I said, we are offering cryo services here. We are able to do it. The trained nurses are able to do the freezing, and those that are beyond them, we are referring to Livingstone General Hospital. Of course, Livingstone General Hospital also goes up to a certain level. Those that are advanced, they are referred to Lusaka.
They are referred to Lusaka.
Yes.
So, do they get any assistance in transport to go to Lusaka because it's quite a distance?
That one, no, it's a general hospital.
It's a general hospital.
The general hospital will explain better to you. But of course, the way the health system is, there's always, when it's a referral that has been referred by the health facility, there's always transport provided.
Oh.
Yes.
All right.
Of course, for us, if we refer, we provide transport for them.
You provide transport.
Yes.
Okay, I was looking at the national statistics and I saw that cervical cancer cases in Livingstone are quite high. Would you tell us why it is like that? Why Livingstone has a higher percentage than other districts in the country?
Yeah. What I would say is that, cervical cancer somehow is related to HIV. So even as a country, as a district, I think we are on the higher rate.
Okay.
Yes, higher percentages of HIV prevalence. So that could be one of the reasons why we are maybe on the higher side where cervical cancer is concerned.
Any other advice you'd like to give to women as we wrap up this interview?
Yeah, the advice that I would give to women, as usual, we always say prevention is better than cure. Cervical cancer can be treated if it's, captured or we identify it at the earliest stage. And what I would tell the women is these services that we have here, they are free of charge. So every woman, actually, as long as you are sexually active, you are expected to come and be screened for cervical cancer. So that before it is too late, we are able to capture the cells, the cancerous cells, and treatment is given accordingly.
How often should someone
the schedule is depends. Okay, when you come, depending on what you have discovered, they will tell you to come again after 6 months. Others will tell you to come after a year. Yes.
Okay, thank you very much for your time.
You're welcome.
Are we good?